Hi, I'm Rachel, and I'm going to today talk to you about pharmaconutrition and why this pathway and this formula is so important in treating patients who have severe inflammation. And then I'm going to talk to you about a case study and the benefits of using this formula. So to begin, all of the research that we have done has shown that this formula is not popular in the United States yet. All of the studies that we have found showed that the case designs and the studies were performed in foreign countries. In my study, they talked a little bit about why, and that's because of the efficacy and the safety of this integrative treatment, and it's because in this treatment you use medications, vitamins, minerals, in addition to the formula, and so the exact nutrient interaction is still unknown. Now, in my case study, the patients all had severe and advanced cancer in the GI tract and just throughout the body. It had progressed to other parts of their body. As a result of this, they had severe oxidative stress. Now what that means is that in the body there is increased amounts of cytokines, which as we know causes an inflammatory response due to increased levels of interleukin-6, INF and interleukin-6. And so this formula has increased levels of EPA and DHA, which are omega-3 fatty acids. And so when these levels are increased in the body, since they're pro-inflammatory, they decrease the amount of inflammation in the body, and the amount of leptin increases, which helps to also combat the inflammation. And again, as we know, inflammation is bad because it attacks the tissue inside the body and causes a multitude of issues. So next I'm going to talk to you about my study, and there were 39 patients, and they were fed 2 cans of ProSure, as you see right here, every day. I know that that's not a lot of formula, but because they were so sick, they weren't able to eat much formula to begin with. They were fed through an NG tube or a PEG, so they were using enteral nutrition, and the patients were assessed once every 4 months to record their progress. And again, they had their advanced cancer patients with severe GI inflammation, in addition to a multitude of other problems. They were basically about to die before this. And they had been eating less than 50%, or for some patients even less than 80% of their daily recommended calories, and so they had significant weight loss and lean body mass before starting this study. So in order to show how they improved, they were looking at grip strength, weight gain, the inflammatory responses in the blood, so they were taking blood samples, and once again, this was monitored once every 4 months. So, all in all, they found that there were significant improvements in each of these categories. The patients gained weight, they decreased the amount of inflammatory response, increased lean muscle mass, increased appetite. So as you can tell, that these are significant increases in overall health, and so thus we recommend that this formula, as a result of this study, we recommend that this study is used. Up next, we have Roberto, who's going to be talking about the challenges of advancing pharmaconutrition, and then we'll give a summary.